Hi, I'm Rohrich, plastic surgeon in Dallas, Texas. Welcome back to Rohrich Knows podcast. Today, we have a very special guest, the beauty broker. Everybody knows the beauty broker, but do you know her real name? Melinda Farina. And, it took me a long time. I said, God, the beauty broker. So Melinda, welcome. Welcome to Rohrich Knows podcast. How are you doing?
Dr. Rohrich, what an honor to be on your podcast. I mean, you're a legend in this industry. So when you asked me to be on, of course I had to accept. And of course, I'm so honored to be here. I'm good.
Well,
in
good.
Rainy New York, it's disgusting here, just going through the days, waiting for spring.
Yeah, no, it's great. I was in New York last weekend. It was cold, but it was crisp, but it's nice. It's New York in the winter, That's what it is.
Right. We have very bipolar weather over here for sure.
That's right. So, Melinda, tell me, I love what you're doing, and I love the name, and you started that in 2004, the beauty broker. So tell us a little bit. First of all, let's tell us a little bit about yourself, Melinda, and how you got to this amazing industry, and really your guidance in that has been truly phenomenal. So you are a native New Yorker or from New Jersey. Tell us about that.
I'm a native New Yorker through and through. NYU, Columbia. I've been here forever. Started in New York City. My career started in New York City, and actually in dentistry. So I was set on a path to be a cosmetic dentist, and I started dental school, and I absolutely hated it. And then I had kind of a coming to truth moment, and I said to myself, "Are you really going to do this for the rest of your life?" I loved the aesthetic industry so much, and I never really kind of wanted to exit completely. So after talking to a couple of the bigger cosmetic dentists, they're like, "You're really cut out for consulting, Melinda.
Oh.
You've got that personality that is you command respect, and, you are really just, how to run a practice, this industry." I started when I was 13 in dentistry, actually, friends of the family. And I just always wanted to be immersed in the aesthetic dental world. And then the aesthetic dental world opened my eyes up to the entire aesthetic world in plastics, in derm. I was lucky enough to start working with a wonderful cosmetic dentist, Dr. Larry Rosenthal,
Right.
who I learned so much from, who really, when you work with Larry was the godfather of dental veneers. And when I started my career, my eye was trained on micromillimeters of a difference on like the edge of the incisal edge of a tooth, or opening up an embrasure. So, I had this very discerning aesthetic eye. I would see everything, and I would see through the scope of like how Larry would see things, and he would put on the loupes and then put the loupes on my face. And he's like, "Do you see that?" So he was constantly pointing things out to me back then. So when you start off in the aesthetic industry, working in dentistry,
Right.
and training your eyes on millimeters, when you apply that to the plastic surgery and derm world, you start to see things, much more clearer. You could see everything.
Which
So
isn't
I
always so
enjoyed it
good.
very,
Yeah.
very much. Yeah. I started a small consultancy as I switched out of dental school and into organizational psychology at Columbia. And I started doing business management consulting for just some dental practices. And I enjoyed it very, very much. But then I really became intrigued by plastic surgery and dermatology. And I asked Larry to make some introductions with some of the bigger plastic surgeons in New York. At that time, he was super close with Dan Baker.
Right.
Larry's son was dating Dan's daughter, and he was close with Dan, and he was close with Dave Hidalgo, and
Right.
he was close with John Sherwin. So he made some introductions, and, there were like open door invites, and I started kind of observing from some of the best in New York City.
Right.
I really loved plastic surgery. And John Sherwin ended up taking me under his wing as kind of like his little student of plastic surgery.
Well, that's awesome. That's all. And of course,
Yeah.
they're all phenomenal.
It's a
plastic
cool
surgery.
story. From there, I kind of had some introductions on the West Coast to Bruce Cannell, and I was able to learn from some of the best plastic surgeons in our industry, watching Nick Tabal, Bruce Cannell, seeing Dan's work, Sherelle, Dave Hidalgo, who's so meticulous, John Sherwin, who's one of the most meticulous surgeons I know. And kind of then went in from business management consulting into aesthetic consulting, and the rest is history.
That's history. So what Melinda mentioned is these are all like huge names in all of plastic surgery and beyond, and I mean, it's phenomenal. And I can tell because you have a very meticulous and a meticulous eye, and a very, very, you go in depth. I mean, you can see more than you can see. It's like a plastic surgeon and beyond, and that's pretty unique. And of course, so how did you get? And I love the name. How'd you come up with the name Beauty Broker? Because that's really what you are, and really you're helping people. So how'd you think of that name?
Right. So the original name of my company was Integrated Aesthetics Consulting, and I loved the name of that company. I thought it was brilliant. Integrating aesthetics. Yes, I work with derms, I work with plastic surgeons, I work with cosmetic dentists. We were doing multiple coordinated treatment planning amongst all disciplines. So I thought it was a brilliant name for the company. The problem with the name of that company was that no one knew how to spell it.
And also they didn't know what to do. But they didn't know what you did. But Beauty Broker kind of says it all, doesn't it?
Beauty Broker came to me from a producer who wanted to green light a reality show around my business.
Really?
Yep. The name of the show was called Beauty Broker, and I was the beauty broker, but that wasn't the name of my company. And she's like, it should be. And I was like, you know what? That's kind of catchy and great for marketing. And so we had this sizzle reel that we did for Lifetime that, thank God, never went greenlit because I'm just not the reality show type of person. Thank God it did not go greenlit. But it kind of stuck. And my girlfriend started calling me Beauty Broker. The whole world starts calling me Beauty Broker. I started, a social media page called The Beauty Broker. And again, we changed the name of the company, Integrated Aesthetics Consulting, to Beauty Brokers, Inc.
Right. So tell us what you do, and how do people, for the viewers, how do people find you? I mean, you've worked with all kinds of amazing people in the world and in plastic surgery and beyond, and way beyond the USA as well. So how do people find you, and then how do you match them? Tell us a little bit about that.
Right. I've never hired a publicist. We've never put one penny into marketing or advertising ever. Great. So, this company, I built it slow and steady, and it's been all through word of mouth. Really just people having good experiences, having, feeling like they've gotten great advice from us, great recommendations and referrals, getting good results from the doctors who we've vetted. So it's really been a lot of word of mouth marketing the whole entire time. The company was built very slowly. I mean, I've been in business now, almost 20 years, a little, over 20 years now. And everything was just built organically. It's been word of mouth, people having good experiences, friends of friends, family. So it's nice that we have these inside referrals through our clients. That is a good testament to the work that we're doing and the services that we're providing in patient safety and advocacy and education, which I think is all very important in this day and age because there's, as you know, such a plethora of misinformation out there, and people are confused and people are being misled, and they're being kind of taken down the wrong paths and promised everything under the sun and coming out with lesser than thou results, spending too much money or getting no results, or just simply getting botched by surgeons who promise them the best results but really don't deliver those results. A lot of smoke and mirror marketing out there. So I think people are just scared. Yeah. When it comes to their face, especially, and their bodies, they're just scared to go under the knife and maybe come out with not such a great result. So not to say I like to police the industry, but I like to keep my eye on things. And if someone is trusting me as their advocate, as their consultant, I really want to make sure that I'm guaranteeing them a great result.
Yeah, no, that's so true. And, today, you're right. There's so much smoke and mirrors. Everybody's famous on their Instagram and their website, and very few people are. And it's all about safety and outcomes. And I love that you do that. And I think people entrust you with that, saying, listen, I want a good outcome. I want to be safe, and I want to be in the hands of somebody that I trust. Anything can happen in anything. It's real surgery, so you have real risks. But I think if you go and find the right surgeon, the right individual, they'll do the right thing. And I think you actually do an amazing job of doing that. So how do you, okay, the individual comes to you, but you don't always give every one of those advice, because, just like for me, when people come to me, I don't always operate on them. So how do you select that individual that you're going to consult with? Or do you say, hey, okay,
Right.
yeah, so you say, hey, maybe they're not for me, or tell us about that, and then I'll ask you about,
Sure.
how do you select a surgeon? But so how do you select that individual that you're going to help? Because you spend a lot of time with them.
We do. We spend a lot of time with our clients. Well, it's really how much time they want to spend with me. So, we are paid for our time because we work for the patient. We don't work for the doctor. And also, when people write into us, we have options. We have senior consultants, women who've been in the industry for 30, 35 years. Margie, who's wonderful. She's been in the OR, shadowing some of the best surgeons in the industry forever. And she is here in New York. I've known Margie a long, long time. I trust her with my life. She's one of the best nurses I know. She does recovery, and now she does part-time consulting with me. So they have options. They have Abby, who worked with Dr. Hidalgo for basically most of her career. And then we have MJ also, who worked with Dr. Hidalgo. Dr. Hidalgo's on our advisory board too, as are you. Yeah. Dr. Rohrich is now a part of our advisory board. We have advising surgeons who we lean on to make sure that we get good people into our network. And we really lean on our advising surgeons for great advice, because obviously I'm not a surgeon. I'm a consultant, but we need surgeons on our advisory board to really help educate us and keep us in the loop in what's new. But when clients come to us, they have options. They could work with our junior consultants, right. They could work with our senior consultants, or they could stay a little bit on a wait list and wait for me. I'm a bit booked out. I think I have a 6-month wait list right now, but I do about 10 to 12 consultations per day.
10 to 12, and of those, how many of those do you select that you work with directly? Half of them, or no? Or do you try
all of them? The 10 to 12 I work with every single day. I have 10 to 12 consultations, and then I see all of them directly, and then my consultants, depending on whatever hours they want to work with for that week, maybe they're seeing about 10 to 12 per week.
Okay, and I think one thing you said that's very important is that the client or patient pays you. The surgeon doesn't pay you, because I know you mentioned that many times.
Yeah, I'm so happy that you're talking about this, because there's surgeons out there who are like, she gets paid. I do not. Doctors do not pay me 1 penny. Great. I wish I would be retired. I'd be in Honolulu, retired. Sipping something frosty and tropical. No, I am not paid by the doctor. The doctors are definitely, whoever we choose, they really have a nice service through our company, because they're not paying a single penny for it. I tell my doctors, the only way you could pay me is with great results. Right. That is how I want to be paid.
And that's the right and honest and ethical way to do that. And I think that's fantastic. But people need to know that. I mean, so,
they do. I mean, of course, when you're a small business and when you're a new business, you try different business models. I think back in 2011, we did try a membership model where doctors would pay a yearly membership. And then what started happening was they were paying the membership happily. And then they started pressuring me for referrals, which was a nightmare. And I didn't feel good about that. So I was like, I don't like this. I don't like feeling obligated. There was one in particular in LA who was really nasty about it. And I'm like, that is it. I'm doing away with this business model. I will never do this again. I don't want to feel obligated to refer. I'm referring from a genuine place where I know that it's a good fit for the patient and it's a great fit for the surgeon. So it has to be that organic, genuine referral. I never, ever want to feel obligated to refer to anybody.
Yep, that's great. Now, Melinda, okay, so what if you get, of those 8, 10, 12 clients you see a day, what if it's somebody that you don't like or don't want to deal with? What do you say to them?
Sure. And we've had that. And of course, they leave negative reviews about me. There's definitely people who cross our plate. I know. This review stuff is really horrendous. I mean,
well, we all get it. If you have perfect reviews, they're not all right. You know that. I mean,
it's not true. Yeah.
Right. So if you have 500
people say, she's nasty, she's a monster. If I feel it's not a good fit, if they're asking me to, get them a result that I feel is going to ruin their life, or, they're asking for fillers only, or they don't want any type of invasive surgery. I'm a surgical consultant. I don't sit here all day talking about filling your face with jelly and putting you under these heated devices all day, every day. I don't really particularly believe in it. I, of course, was trained by old school surgeons, what is tried and true. Bruce Canals always told me, do always what is tried and true. And that's always going to be the surgical procedures, Melinda. You're going to see these non-invasive things come along. They're going to come, they're going to go, and that always stuck with me. And I thought he was just such a wonderful mentor. I learned so much from Dr. Canal. And he went on to train so many wonderful surgeons in our industry today. But, he really left his mark on the industry, and he really left his influence and his mark on me, as did Dr. Hidalgo, as did Dr. Sherwin, as did Dan Baker. So learning from people like that and hearing the repetition of what they teach at the meetings and what we preach in our industry and, and in our journals, which I love PSP Journal. It's incredible. So, just through all of this, I tell my clients, if I don't feel it's the right fit for me, I'm going to reimburse you, and you could find another consultant out there. I really don't want to be a part of that.
That's great. And I love that. And actually that takes you to a higher level. So the corollary of that is, okay, so how do you select the surgeons you like to work with or that you refer to? How do you do that? I know, I'm on your advisory board just recently, but I mean, to you, it's also your intuition, and you know all the surgeons that I think you refer to. Of course you do. You've seen their work, and you've seen their patients, and that's a good thing. That's really what it's all about.
Well, we look for consistency. We look for ethical practicing. We look for the care. We look for the pedigree lines. We look to see who mentored who. I'm always looking to see who you are training and who your fellows are. I'm like, okay, this is a Rohrich guy. I got to keep my eye on this guy. So I'm constantly keeping my eye on fellows. I'm constantly keeping my eye on the pedigree lines. The Glasgolds, the Vito Quatellas of the world, the Jim Stuzens of the world, the Hidalgos of the world. I really look to see who they're teaching because that their offspring is going to be phenomenal. They were taught the right way. They were branded with those values that, I hold very dearly because those are the surgeons who taught me and those were my mentors. So I'm constantly following those pedigree lines very, very, very closely. Right.
I think that's very important because, good surgeons know good surgeons and we train good surgeons. And I think that's really what it's all about. And it's not perfect. I mean, everybody can have an issue and a problem. So how do you handle it? So you sent this patient to to a great surgeon, and they get not so great results. But I mean, it happens sometimes. So how do you manage that? I mean, that's part of
right. I give them a chance to make it right, and usually they do, and they're like, Melinda, don't worry about it. We're going to have them come back in. We're going to make it perfect, and as long as they see it through, we had a situation with a surgeon in New York, a facial plastic surgeon who a lot of people know, where I worked with him for a very long time. And then the work just started kind of dwindling. Yeah. It was like poor result after poor result after poor result. I had 3 very horrific things happen with my clients, and I was mortified. And I went to call him, and he's usually the type of person who would always pick up my phone calls and respond immediately and be like, whatever it is, I'm going to take care of it, Melinda. Don't you worry about it. We're going to make it perfect. And I just never heard from him ever again. Oh. After 13 years of referring to this person, never heard from him again. It was bizarre. So I was like, okay, well, he's automatically out of the network. But then, I had to take matters into my own hand and get my client to another surgeon who then, of course, did a favor. And then somehow we got our client reimbursed by the original surgeon. But we really try to avoid that. We really try to keep our eye on consistency. Usually we'll start to see a tiny little thing happen there, tiny little thing happen here. And I'm like, you know what, let's just kind of put him on probation for a while. Right. And we'll just continue to watch the work, but maybe he's just, as you know, a lot of surgeons deal with burnout. Maybe he's dealing with a little bit of burnout at this point in his career. Maybe he's just overwhelmed. Maybe there's too much volume. Right. Once they get too popular on these social media channels, that's usually when I cut it off. I stop referring to that doctor. I'm like, he's probably too busy. I just don't want my my client to be a statistic. I like working with surgeons who are a little bit more under the radar, who care less about the social media, who care a little bit more about the quality of the service and the results. So you'll see a lot of the surgeons that we work with are very under the radar. They barely have social media presences. Some of them are working a little bit on the social media stuff, but that's not the most important thing for me. The most important thing is the care, the quality of the results, and that it's imperceptible, meticulous results.
Right. That's what it's all about. It's all about the elegance and the beauty of a natural result. That's what, that's what plastic surgery is, especially aesthetic surgery. A great result is one you would never know. And I think that's phenomenal. So, phenomenal. So what are like the three things, Melinda, that you would like to tell our viewers when they're looking for a plastic surgeon? I mean, obviously, they're obviously going to consider talking to you and your incredible team. And you're around the U.S. everywhere now. I mean, you can do consulting around, because with Zoom, you do it around the whole, in the world, right?
Around the world. Well, we don't have Asia. We don't have Africa. We do not have really, we have a small network in Australia. And crazy enough, we don't have Canada. So Canada is going to be kind of, I know, it's kind of a no-brainer. I should be in Canada. We're not yet. So we're going to try to grow our Canadian territory this year. We're working on UAE. Europe is a beautiful network. We have a beautiful network in Europe. North America and South America, phenomenal. And so that's the majority of our vetted surgeons right now. But now that I have you on the advisory, where you and I are going to find more surgeons in Canada together.
Oh, yes. I know. Well, wise words from a wise woman. And if you're going to consider having, a level of aesthetic surgery where you really want to get some consistency and great results, I think you should highly consider the Beauty Broker. So, Melinda, great. I love talking to you. You always make a lot of sense, and you always have your patients and your client first and foremost in your mind, and it's all about safety and outcomes. And I think that's what we all want to do. And you have that sixth sense of, you can sense whether somebody is really passionate about what they do, and so do all of us that are in this area, because in the end, it's all about our patients, bar none. That's really, it's outcomes and being safe. So kudos to you.
Thank you so much. Safety is key. It's crucial in this industry. What I'm seeing on the social media with doctors dancing on TikTok and doing things in a silly way, it's not how I was trained and taught. That's not how things were 15, 20 years ago. And, we didn't have social media back then. Things were different. People had to earn their place in the industry, as you know,
right.
And it wasn't easy to do. It was a certain level of respect that was held for the surgeons who really kind of like set the tone for what our industry is today. And now, I hate to see the seriousness of it dwindling, and I really want to bring that back. I think it's really important to bring the respect back to the industry and the seriousness back to this industry. This isn't all for entertainment and, like trends. Plastic surgery is medicine, and we have to take it seriously. And I think the surgeon should bring it back down to that level of seriousness and not be so jokingly, fluffy about things in our industry.
I agree. I mean, real plastic surgery, real risks, real options, real operating rooms, and the Beauty Broker brings that to you in a great way. So thank you so much, Melinda. It's always a pleasure chatting with you, and keep doing what you're doing. It's really great for our industry, for cosmetic surgery, for cosmetic medicine. You're doing the right things. I love that. So.
Thank you so much, Dr. Rohrich. It means so much coming from you. It really does.
You bet. Leave us your comments and thoughts. And if you have any questions, please contact Melinda. And it's at beautybrokers.com, correct?
TheBeautyBrokers.com. Yes.
TheBeautyBrokers.com. And we'll have that on the podcast as well. So thanks again. And we'll enjoy having you back again with us soon. All right.
Amazing, Dr. Rohrich. Thanks for having me. I appreciate it.
You bet. Thank you.